Our first call comes from Boca Raton tonight. Good evening, you're on Newsmakers.
Good evening, thank you. This question is about something perhaps a little less dramatic or critical, but if one has melanine spots or liver spots or other disfiguring marks on the face or chilblains, little veins around the nose, I have heard that there is a laser method for boiling those off that can be done. Is that true, and would you mind addressing the question?
Sure, thank you. That's a good question. Laser surgery is wonderful surgery as long as it is understood as to what it is. And from my understanding, laser surgery is concentrated energy. It is excellent for trying to maintain getting the bleeding to stop and using it for such. The problem that I've seen or heard addressed with it is that unfortunately, as it is passing through the outside skin to get to a port wine stain or a discoloration, there usually is some damage to that overlying skin. So there may be a scar that is produced through that. And I think one of the things that you will find for those that use laser frequently is that they will tell you, yes, we will hopefully be able to get rid of some of these blemishes, but as a trade-off for that, you may also have a scar or disfigured area that is a result of that. The liver spots themselves is a different phenomenon. It's what we call either actinic or senile seborrheic keratoses. These are things that the dermatologists see frequently. I see them as well. My mode of treatment, if they are amenable, is to excise them, which also will leave a scar. Sometimes we will think about using a chemical peel, but there are trade-offs with a chemical peel too, which can be bleaching or permanent discoloration of those areas. So I think that the key out of all of this is that as we are looking for answers, we should remember that we are human and that these are imperfect sciences and that there may be a side effect or something else that is involved that you should at least know about before you go ahead and say, well, this is going to be the panacea, the magic wand.
Thank you for your call. Another one comes from Boca Raton. Good evening, you're on the air. Hello?
Hello.
Yes, go ahead.
I had a facelift about 10 weeks ago, and I had a chin implant and a dermabrasion all at one time. I still have a lot of swelling that comes up and down as I am very hyper. My grandbaby just had open heart surgery and everything, and I can't understand it. It comes up if I put a little bit of ice on it or what, I don't know what to do about it. It's been about 10 weeks.
Well, I think that the question for you is it getting better?
Have you noticed any reduction in the swelling?
Well, it'll go up and it'll go down. If I get hyper and it comes up, like right now, the glands underneath the neck are swelled, and the cheeks are swelled up.
Okay.
Does it react to stress?
Well, I think what we're talking about here is that there are three phases to this. If you think about circulation, most people understand that there's an artery that takes blood to an area and there's a vein usually that takes blood away from that area. There is a third part of this, which is what we call lymphatic circulation. And lymphatic circulation is actually that circulation that drains the fluid from around the cells. And oftentimes what we will find is that the arteries and veins, if you think about what the facelift is, it's actually separating the skin and soft tissues from the underlying structures. And that means that you are separating the arteries and veins and lymphatic system, and that system is only being activated at the edge, or if we're cutting along the side and we're lifting the face and soft tissues this way, really from the central portion is where you are getting the vein, artery, and lymphatic drainage. So until those processes can revascularize, where the lymphatic channels can come back into play, then you will have some degree of swelling that may be cyclical and may be periodic, but on the whole should improve with time. I suggest to my patients that they get into a procedure of massaging, not only with skin cream massaging with their fingers, but also using a warm washcloth or a hot bag, something of that nature, not hot, but something that will massage the areas and try and move some of that fluid out, and yet at the same time try to invigorate or stimulate the circulation to regenerate and get back in. But the real answer is it takes time, and I think if you're patient and work with it, you'll get better.
Thank you for your call. North Palm Beach, you're on Newsmakers.
Yes, I was interested in finding out. More about breast implantation and what the recovery time for it is, and the general cost of it.
Okay, the breast implant surgery or breast enlargement, what we call the augmentation mammoplasty, is surgery, again, as you've seen on the screen, for the reasons that we've talked about. The recovery time is individualized again. Usually what I tell patients is that for the first 7 to 10 days, 2 weeks, I really would like them to be with limited arm activity, because again what it comes back to is how we're doing the surgery. We are creating a pocket either under the muscle that's across the chest or above the muscle that's across the chest. And again, as we've talked about, we are separating the blood vessels, the arteries, veins, and lymphatic system from the overlying structures. So when you are putting in an implant, you are leaving an open space that eventually will scar and provide a closing, but until that occurs, you have raw surface against raw surface. So the greater the activity is, the greater the chance for developing a bleed or a hematoma, which you may have a problem with. So my general recommendations are for the first 7 to 14 days to take it fairly easy. After that time, you can get back into your routine, but really to stay away from vigorous activities such as aerobics and jazzercise and horseback riding, things of that nature, for about 2 months. I think that you're fine. I think the cost of it is variable. It depends on where the surgery is going to be performed. So for me, I would do it either at an outpatient center, surgical outpatient center, or through the hospital outpatient with the potential for overnight stay. And with that, you're concerned with the facility cost plus the anesthesiology cost plus the surgical fee. So anywhere in a range from between $2,000 and $5,000 plus or minus is the figures that I've seen.
What about an implant if you need to have, and all women are advised these days to have mammograms? Can you have a mammogram with an implant?
The mammogram is something that is terrific, because in this day and age, as we begin to get more and more tuned in to preventative medicine, it is a wonderful tool for preventative medicine. The problem with it is, in the general population, it misses perhaps between 10 and 20% of breast cancers. So again, that all things are not perfect, and mammogram is terrific, because if it gets 80%, well, then we really have done a wonderful thing. I would advise having a mammogram done before the breast implant surgery, and then after the breast implant surgery on a yearly basis to have the mammograms done, or every 2 years afterwards. And in today we have what we call a tangential view, which is an additional view that we will do for those folks that have had the breast enlargement surgery done. But that's something that should be discussed before surgery, and your point is well taken.
What about breastfeeding after you've had an implant? Is it still possible to breastfeed?
It is, because, again, we are not violating the breast gland. We're leaving the nipple, areola, and breast gland intact, so the implant itself is placed either under that gland or under the muscle that's under the gland. So either way, we're no problem with that.